So I had a little brief look at this earlier already, and it seemed like your main concern was the skin laxity. Is that correct?
Everyone in my family has like jowls and a double chin, and
yeah.
I just hate it. Like when I move my face like blends into my neck.
Oh, okay.
It's just not. I feel like that. Not that I'm old, because I'm not, but the
not
older I get, the worse it gets already.
You
and I look at my mum and I think I just don't want that to happen.
Yeah. So if you could just briefly summarise kind of when you first noticed it, has it got worse? Has it got any better? Have you done anything to treat that particular area?
No, I haven't done anything to treat it. I didn't really know what to do.
Okay.
And then I saw Endolift a few times, and I just kept thinking about it. So.
Yeah. Perfect. So so Endolyft is a really nice intervention to treat the kind of the face and underneath the chin, especially the what they call the double chin area. Yeah. Because with this device, obviously there are limitations to how much you can do. Yeah. With any energy-based device in comparison to surgery. Obviously we'll scan your face with the ultrasound, and we'll have a little look at the two main layers that we can treat, and that's obviously the skin, which contains your dermis, which is the layer that holds all of the elastin, the collagen that keeps the skin firm. And then where the actual laser fiber wire goes through, called the subcutaneous plane, is another area that we can treat. And that is called, that medically it's called the subcutaneous layer, but all it is the superficial fat layer. And within that we can dissolve some of the fat cells that are there and liquefy them, and then we can remove some of those as well. And then at the same time we can tighten both of those layers using different settings on the Endolyft machine. So the good thing about it obviously is that there's no cutting, there's no scars, there's no stitches, so the downtime is obviously lower. But then we always have to explain to our clients that it is not going to replace a surgical facelift or a neck lift, because we're actually treating above the muscle called the platysmal muscle. So anything below that, or the muscle itself, it can be treated surgically, and that's why you can get a really nice sharp jawline, what we call the cervical mental angle. You can really accentuate that by bunching, plicating that platysmal muscle on the sides and bunching it together. You can remove deeper structures like sometimes muscle, sometimes certain glands, sometimes even the deeper fat pads. With this, obviously, we're treating everything above that muscle, so that's why there are limitations, and you cannot kind of advertise it as a replacement of of a surgical procedure, because there are anatomical limitations, and that's the only thing we always like to explain. So here we're just trying to target those two superficial layers, and we still get really nice results. And in most cases, in the younger cohort, it's those two layers, or the superficial fat layer, that we try to reduce the volume in the most. Okay, but we'll have a little look to see how thick it is in your case. Because sometimes, anatomically, as you mentioned, a lot of your family has it, and you've had it your whole life. Yeah. Some people say, even when my weight fluctuates, it's still there. Yeah. So that basically kind of tells us that maybe there are anatomical variations that are slightly deeper that are just you. Yeah. So unfortunately, we may not be able to target with this, but at least we can improve everything on top of it. Yeah,
because it has definitely gotten worse. Like this bit never used to be it used to be more tall and slimmer here, and that sort of. But I do think it's all sort of just this bit's dropped a bit, but that's just So it has gotten worse.
You've noticed that it's got worse. Okay.
Yeah, it never was this bad. But
so it's definitely still it's kind of a great intermediate treatment in between, obviously, the injectables and something more invasive. So obviously, this being minimally invasive, the downtime is much less. What to expect after the procedure? It might be a little bit red for a couple of days. There will be a bit of swelling, as to be expected, because we have to put some numbing injections in. And that can last between 3 to 5 days. Some people swell a little bit more than others. But it's really crucial for that first week to take it easy. Don't do anything strenuous. No going to the gym, long hikes, things like that, because it can just prolong the swelling and the redness. And it can, extend it up to the kind of 7-day mark. But we'll give you a garment to wear that you can wear underneath the chin, strapped up to the top of the head and the back. For the first couple of days, you can wear as much as possible, just because it will reduce the swelling. And then at night for the following 5 days. And then after that, you can stop wearing it. you'll probably see after 3 to 5 days the swelling significantly reduced. You'll probably, towards the end of that period, you'll notice that the face is a little bit swollen, but probably other people won't. If we do some of the micro liposuction, sometimes that can extend the swelling for a little bit longer, even to the 7 to 10 day mark. Okay. So that's why it's really important that we wear that garment. Yeah. The only other things to mention, the skin may feel a little bit different as well, because it's a energy-based device. It obviously delivers energy and it gives heat, so it will feel like a sunburny sensation. Might just feel different to other layers of your skin. But as the swelling reduces, after things recover, it will slowly come back to normal. Okay. Okay. Did you have any questions at all about what we're going to do today? No. No? And you've not had any recent treatments to the face, the skin, no recent infections in the mouth, teeth, skin, nothing like that? No. Good. So what we'll do next is probably just scan the area, if that's okay. Okay, so we're just about to start an Endolyft treatment for the full face and under chin. Before doing so, we always like to ultrasound this area, and the key layers that we look at before commencing our treatment is the subcutaneous layer, which is obviously the layer that contains our superficial fat, and we can see quite clearly there that there's a sufficient amount for us to reduce. We can see the fibroseptic network, which are the white strands that can also be tightened with the Endolyft. The very top layer we can see is the dermis there, and that's another layer with the Endolyft machine. Hopefully will stimulate a bit of collagen production and elastin also to achieve a nice amount of skin tightening. Beneath the subcutaneous layer there, I can see that there is the platysmal muscle, as we've already discussed in our consultation, that this energy-based device and other energy-based devices are solely used for the tissue above that platysma. If we were to treat the platysma or the structures beneath, then surgical intervention would be required. When we consider surgical neck lifts, there are various sections of the procedure itself that we incorporate to get a nice lift within this region. That includes the plication of the platysmal muscle, which is the bunching of the muscle on either side of the neck. Also, we could surgically sometimes remove the deep fat pads or a portion of them, and sometimes even the deeper muscles, including the digastric muscle. And even in some patients, there is a enlarged or drooping salivary gland called your submandibular gland, which we can also partially excise. So there are limitations with what we can achieve with the Endolyft in comparison to surgical intervention, but this is a fantastic result if we're aiming to reduce pockets of fat and also stimulate collagen remodeling to tighten the skin. So we've just cleansed the skin prior to marking. So what I do first is mark the border of the mandible, which is the jawbone, just so we can work around that and try to achieve an improve the definition within this area. And also it kind of allows us to know where certain anatomical landmarks are, including the marginal mandibular nerve. As we know, it is a structure or branch of the facial nerve that comes around the jaw, and it's tucked in underneath, but then here, close to the corner of the mouth, it actually becomes quite superficial. So every time I treat this area, I mark it out and I don't go over where the nerve is. And so I just mark it and treat everything that's lateral to it.
Here we go.
So sometimes with our tumescent, we obviously have the numbing agent, which is usually either lidocaine or bupivacaine. One's short, one's long acting. The reason why we sometimes add a little bit of adrenaline to our tumescent is to allow us to use larger volumes. So we are able to use much more lidocaine if we use it with adrenaline. and that obviously reduces the risk of any toxicity. And the other important factor, B, is that it reduces the amount of bleeding or bruising because it vasoconstricts the vessels in the area that we are going to treat.
Here we go.
So now that we've marked the face and the neck, we also want to mark out where we will place our vectors, which is a technique that we can utilize with the Endolift machine. These vectors are important as it allows us to follow the natural lines of lift within the face and the neck, which also allows us to uniformly heat the subcutaneous tissue. And with the collagen remodeling that will happen within the area where we deliver these vectors to, we'll get a nice natural lifting effect. So we've just finished the debulking stage of the Endolift treatment plan. So with the Endolift machine, we can individualize every treatment by setting different parameters depending on what we're trying to achieve. And as I mentioned, obviously the first stage was to debulk small pockets of fat. So very small volumes of fat can be dissolved with this machine. Obviously there's limitations with larger volumes. Therefore, we need to take that into account, and having an objective measurement like the ultrasound is a fantastic tool to implement to allow you to make the right decision. So the next stage will be the skin tightening element, which will firstly start with the face, then the neck, and then we'll begin with the vectors. And another aspect that we can incorporate is a small amount of micro liposuction as well. So we're just at the skin tightening stage of the Endolift procedure. And the fantastic element of this fiber optic wire, it's precision. So as you can see, the thermal energy is only being delivered at the tip of the wire, not along it. And with the right parameters, it enables us to either dissolve or debulk small pockets of fat or tighten the skin. The remodeling aspect of it doesn't happen instantly and it starts to begin after a couple of weeks. And we do start seeing results after 4 to 6 weeks, but the final results are usually 4 to 6 months down the line, as we need to give your own body's physiology time to build that collagen, that elastin that it needs to remodel the skin and tighten it. This will enable us to achieve better facial contours and definition, and at the same time debulk these small pockets of fat.